Please step up with me. Please tell me who you are, where you live, and what's on your mind.
Hi, I'm Jackie Kiger. I live here in Asheville. I'm a certified navigator with PISGA Legal Services, and so I just wanted to make a really brief comment just to let people know that PISGA Legal Services here in Asheville, as well as the Council on Aging of Buncombe County, are navigator organizations. We have staff and volunteer navigators who are available to provide information and support to those who want information about this. We also recognize the excellent work that the brokers and agents are doing, and so we're just another resource that's available. And we do have a toll-free state number that people can call to get assistance.
And that number is?
Can I give that number?
Absolutely.
Great. So for those who are hearing at home, it's 1-855-733-3711.
That's the one I was talking about.
So feel free to call us, and we can help you if you've got some questions.
Thank you very much.
Thank you.
You know I want to get back to our social media because there are a lot of folks at home who want to weigh in on this. We've been blowing up all evening on with both Facebook and Twitter. So let's go back to our digital desk and see what Frank has for us.
Well, Mark, so far we've had over 1,300 people get involved through Facebook and Twitter, and these are some of the comments that we're getting about that question. This is Travis Cagle, and he says, yes. Government mandates okay. Guess I can tell who votes for who. Of course, this thing is confusing to a lot of people. Yes, if you're in it for higher government, is what Chris Galloway writes. And if we look over here at Twitter, completing an application and actually having health coverage are two completely different things. And Guy Smith writes in the town hall, hashtag, what moral right does the audience member have demanding someone provide their labors, their life to someone else? We want to post some comments that came in to us through our website. If the several GOP governors and legislature would do what is best for the people instead of what they think is best for party politics, the ACA could do far more good for everyone. That was from David Teague. The next question, we're going to put this on our screen as well. I have insurance for the first time in 13 years. I cannot understand why any decent person would begrudge me this opportunity to finally get health care, from Tara Andolfini. And then lastly, our question, I'll leave you with this. What is the loss of local jobs, hours for health care staff locally because of the impact of the denial of Medicaid expansion? That comes from Vicki in Asheville.
Well, that's a tough question, and I'm just going to at least maybe narrow it down. Cody, has there been any impact in your industry in terms of the Affordable Care Act? Has it affected employment in some form or fashion? If so, how?
We estimate that due to the Medicare cuts in the Affordable Care Act.
Let me interrupt you. How many hospitals are we talking about in the state of North Carolina?
All of them. We have 130 more.
More than 130?
More than 130.
Okay.
We're looking at about $1 billion a year in cuts in Medicare because of the Affordable Care Act and sequestration and all that. Because we didn't expand Medicaid, we estimate that the state is losing out on $400 million in employee salaries alone, just for that one segment. So it's a chunk of change, and we're going to have to figure out how to make that money up somewhere else.
This is an opportunity for me to ask my last snap poll question of the evening. I'd like the audience here to respond with the sound of applause. Your two choices and answers are yes and no. Please respond to this statement. News organizations have presented the topic of health care in a thoughtful, impartial, and balanced approach. Those who believe yes, please applaud. Those who believe no, please applaud. In case anyone's interested, my resume will be posted in the back wall after tonight. Please tell us who you are, where do you live, and what's on your mind.
Hi, my name is Peggy Wheel. I live in Asheville, and I guess my question is for Cody Hand, and it addresses Medicaid expansion specifically and how it affects the hospitals in our state, particularly in our small rural communities. You're talking about cuts that are coming because of an anticipation that we were going to expand Medicaid. So now that our state has chosen not to expand Medicaid, what are the implications and how will it affect access to care to our communities in our smaller communities where we don't have, like a large hospital system?
Let me just say first off, we're doing our best to make sure it doesn't affect access to care. What we're worried about is in our rural communities who have a very large Medicaid population, we're going to get the patients anyway, regardless of whether or not they would have been covered or are covered. What we have to do in those situations is figure out a way to make up the cost that we lose by not getting paid to treat those patients. And a lot of times we have to do that by cost shifting onto our small businesses who pay their health insurance. It is one of the main reasons that health insurance in the private market is so expensive, is because your providers have to cover the cost of the uninsured. Now, the Affordable Care Act meant to make sure everybody was insured, and that is a great thing, and your hospitals would love it if everybody was insured, but the access to care is going to be there as long as we can continue to pay the bills to keep the buildings open and the staff there, and we are doing our best to make sure that we can do that.
So my follow-up to that would be that the hospital association would benefit, and I mean, not the hospital association, but your position is that Medicaid expansion is a good thing for North Carolina.
My position is everybody needs to be insured for it to be better, and if that's through Medicaid expansion, then that's how it should be.
Thank you.
Leslie, you're shaking your head. You wanted to weigh in?
Yeah, I think if part of the problem with not expanding Medicaid is that we, as taxpayers in this state, are still sending money to the federal government, and that money is not coming back to us. It's going to states that are expanding Medicaid, and the money that used to come to us to pay for the care for people who can't pay is no longer coming to us. So we are losing, I don't know, what's the figure?
At least $1 billion a year.
At least $1 billion a year. So we're talking thousands and thousands of jobs. We're talking, $1 billion a year or more, and we're talking the lives of 2,800 people who will die from lack of access to health care. So that's the cost.
I'll follow up on that.
Please.
So Medicaid advocates or Medicaid expansion advocates want to say that, hey, it's free. Medicaid expansion is free to the state of North Carolina. Yeah, that's true. For the first 3 years, the federal government will foot the bill. Fine. We're all taxpayers, so we're all footing the bill. After that, for the expansion part, the federal government will pay 90% and the state will pay 10%. According to a study by the Kaiser Foundation, the Medicaid expansion will cost North Carolina more than $3 billion over the first 5 years that we're paying. That's $3.1 billion between 2017 and 2022. That's real money that is going to have to come out of the state budget somewhere. So tell me, would you like to come out of education or the Department of Natural Resources or the Department or the State Highway Patrol? Where would you like that $3 billion to come from over those 5 years?
Tax hikes on the wealthy?
Oh, tax hikes. That's
On
the answer.
wealthiest?
Fantastic.
Yeah. I have a question for the panel, and earlier this evening I shared some polling results, again, going back to public policy polling of January 14th. 38% of North Carolinians support Obamacare, 48% oppose. But then also the Elon University poll of November 15th through 18th of 2013, that the number one issue as far as North Carolinians was concerned was health care and the ACA with 24.4%. But also in that same Elon University poll, it found that North Carolinians believed that under Obamacare, 53.6% believe it makes health care worse, at 30% believes it makes it better. And I'm a little confused because sometimes the numbers don't seem to make sense. North Carolinians say health care is really important to us. We're not certain if this is the right way to go. Am I right to be confused, or is there really something that kind of makes sense and I just don't understand it? Alec, what do you think?
It's definitely confusing. The law itself is a very enormous law. It's very complicated. It takes us speaking with people individually. We've probably spoken with 10,000 people in the last 6 months to try and explain it to them. So there's going to be a lot of conflicting numbers because people just don't understand it. And the other thing you'll find is when you start digging down into specifics of the law, most people prove that everyone should have coverage regardless of health conditions. Most people agree with letting children stay on the policies until they're 26. So a lot of the particular points of the healthcare reform law, people agree with. It's just the law is so complicated, it's very difficult to explain it all in a newscast when you only have a few minutes to talk about it. It is a very complicated thing to get through. Yeah. So that's why you're going to find these conflicting numbers that maybe at a global level it doesn't look good, but then when you get down into it, you start seeing there are benefits. It's by no means perfect, but I don't think it's as bad as some people make it out as either.
And I think it looks like all of our panelists want to weigh in here. So Leslie, is this a matter that everyone agrees with the end result? We know what we want to achieve. The question is, how do we get there?
I think that's part of it, but the other part of it, studies have shown that if you ask if people approve of Obamacare or disapprove, the disapproval numbers are much higher than if you ask if they approve of the Affordable Care Act. I have also seen someone signing up for insurance and saying, wow, this sure beats Obamacare. So, yeah.
Cody.
And I'll just weigh in from a provider perspective. It is very confusing, and your doctors and your hospitals are just as confused as you are about what the law means and what it does. We're still here providing the services for you no matter what, but we are ourselves trying to navigate through the however many thousand-page bill that was and the regulations that have followed that are even more confusing.
Donald?
I think if you read the name of the law, Patient Protection and Affordable Care Act, man, that sounds awesome. Great, and that's what everybody wants. Who would be against patient protection and affordable health care? Nobody. The problem is that you have things like higher premiums. The Manhattan Institute estimates that North Carolina will face an average 136% increase in premium costs. We were promised by our president and our U.S. Senator that if you like your plan, if you like your doctor, you can keep them. 473,000 North Carolinians lost their plans, and when they got them back, when they were given a fix for a year, Blue Cross Blue Shield announced that those costs would go, those plans that they had just a couple of days earlier would increase by 16 to 24% over the next year. It's a great name for a law, but the rollout's been terrible, and nothing about this is affordable at all.
All right. Now, we're getting down towards the end here. Before I get to this gentleman's question, I know a lot of folks at home want to be a part of this because the questions are kind of winding down here, but they're blowing up on social media. So let's go to our digital desk. Frank, what do you have for us?
Well, Mark, some of the questions we are getting, this is on our comment basically from our Twitter account. No guarantee expanded Medicaid dollars returning to North Carolina after 3 years. AFP NC CBO predicts that O-Care will still leave between 26 and 27 million Americans, nearly a tenth of the country, uninsured. Now, some of the questions that we have, will healthcare.gov automatically send children who qualify for Medicaid over to social services? That came into WLOS from Stuart Engel. And another question that also came into our website, Americans were told by President Obama that households would see an annual savings of around $2,500. Instead, our cost of health insurance has risen more than 1,600%. Why? Can you explain this, Mark?
So why has health insurance gone up if we were told it was going to go down? What do you think, Alec?
There's the essential health benefits. Those 10 benefits that every plan has to cover now is going to mean many plans are going to cost more. There were some very bare bone plans out there, plans that had $20,000, $30,000 deductibles. Because of the law, no plan can charge more than $6,350 in total out-of-pocket expenses during the year. So it shrinks the amount of costs that an individual can incur before the insurance company starts paying. So what that means is you might have had a plan for $40, but it could have been very, very basic that still would have left you with tens of thousands of dollars worth of bills. So you're paying a lot more, but you're getting a much better plan. The other point too is, I'm not sure what this person, when he put in their 1,600% increase, but subsidies are playing a huge role in helping keep cost under control for a lot of people. So I think you have to look globally, what is it doing when you include subsidies in there? For some people, yes, very definitely, they're going to face much higher cost. Other people are going to save significant amount of money when they get their subsidies. So it's a balance, and there's going to be people that come out ahead, people that do end up paying more, unfortunately, because something this big, there's no way to make it perfect for everybody. It just can't be done.
And quick follow-up with Cody. So was the president wrong because he didn't have the right information, or is it just part of the politics you talked about earlier, the salesmanship in order to get it passed?
I think that's exactly what it was. I want to go back to Donald talking about Senator Burr's bill that he introduced, I think it was Tuesday. I spoke with Senator Burr about it. The text is yet to come, but I think everybody from both sides should look at that bill and what it provides. It still protects pre-existing conditions. It still protects children under the age of 26. It has a lot of things that everybody likes about Obamacare, but it has a lot of the things that everybody thinks need to be changed. So I think we all need to get together and realize that there's got to be some changes to it, and maybe we should all get on the same page as to what those changes are, and I think that bill might go that way.
All right, I'm going to have to head back to this gentleman for our last question of the evening because we've just about run out of time. Please quickly, it's going to be lightning round question.
I just wanted to clarify what Alex said when I sat down in regards to brokers and navigators and what's happening in the system and costs. It's not like buying a car. You don't negotiate a price. The rates are set by the Department of Insurance in the state, and the rates are exactly the same whether you buy from a broker, whether you buy from a navigator, whether you go online and get it direct. They are not, there's no difference. The only thing you have is an advocate in your corner with a navigator or a broker versus going in nebulous space on your own on a website that you can't navigate. That's why you don't want to do it by yourself. So I wanted to make that clear.
Okay, thank you. Well, we've kind of run out of time already for this evening, and you've seen a lot of spirited and passionate debate on a very emotional issue. No doubt about it, we all have concerns about this particular topic. But I think that even though we disagree, where some advocate everything from a single payer and larger government role to greater individual freedom of choice and individual decision, I think we can all agree that healthcare in recent years has gotten more complex, more complicated. There are more rules and regulations. It's made it more difficult for us to make the choices that we need to make. But the other thing we can all agree on is we all want affordable healthcare, quality healthcare at an affordable price, and not just for our parents, and not just for ourselves, but for the next generation, because we want to leave to our children and our children's children a better America than the one that we inherited. On behalf of our panel of experts, everyone here in the studio, and the News 13 crew would like to thank you at home for joining us here this evening. And as always, we salute our military, law enforcement, firefighters, EMTs, and other emergency personnel for all that they do. I'm Mark Hyman. Good night.